wow, I did that. Just like utter relief and joy. It was just so incredible. So I've been a labor and delivery nurse since I graduated nursing school 9 years ago. I've worked on a high-risk labor and delivery unit that whole time, and a lot of people, when they found out I had a home birth, were like, how on earth did you come to that decision? So there were a couple things that were major contributing factors to this choice. I think the main one that comes to mind is how fast my first labor was. I had my first child at the hospital on the unit where I work, and it was a very surprisingly fast labor. It was so uncomfortable, so stressful. And as I made it through like the first trimester with my second pregnancy, I just kept thinking, if I had a 4-hour labor with my first, how fast could the second labor be? And how am I gonna know when to go in? And having almost 2-year-old at home, like trying to manage childcare and kind of planning. And also home birth has just always been something that I've been interested in, something that really helped me kind of feel safe choosing a home birth, was that she's able and like legally protected to write prescriptions and administer medications, including IV medications. She has all of the emergency postpartum medications, and she also carries an oxygen tank and like a portable radiant warmer type thing, and all of your resuscitation, deep suction, all of it right there. So my labor took a very unexpected turn. It was not the short, rapid, precipitous birth that I had, hoped and feared it would be. I slept all day because I had worked the night before, and I was getting ready for work. It was around like 5:30 p.m. I had my lunchbox, my bag to go into work, and then all of a sudden a big gush of water to the floor. I was like, oh, maybe I just peed myself. And so I went to the bathroom, and I had some little pH testing strips that I had acquired, and it turned bright blue, which is an indicator that it was amniotic fluid and not urine. So I, like, sitting on the toilet as fluid is like continuing to come out in little spurts, called my midwife, basically started crying because I hadn't been contracting at all. I had no signs of labor, and one of like my worst fears was that I would break my water, not be in labor, have to be induced or augmented, and end up with like a whole cascade of interventions that I didn't want. My midwife was very calm. She told me to, take a nice walk, feed myself, and then try and sleep. I started to contract within the hour of my water breaking, and they were very mild. I could talk through them all, essentially. I would say they felt a little bit like period cramps, but more than anything, I felt them like almost like externally. But they were very regular. They were like every 2 to 3 minutes. And so after a couple hours of that, I called my midwife to let her know. And she was like, start filling up the labor tub, just because it can take a while to fill up. And so I was like, yeah, contracting every 2 minutes, let's fill up the tub. So we were really excited to fill up the tub, but we didn't look at the instructions on it. So the tub is an inflatable labor tub that the midwife can rent to her clients. You have to purchase your own liner for the tub, and you're supposed to put the liner in first before you fill it. But we did not do that. So we got like halfway through filling the tub, realized our mistake. Of course, it's like way too full and heavy to like tip over, so we had to scoop out the water with pots and pans and dry it off and then put the liner in. So it was like a whole long drawn out process. I clearly wasn't like contracting very painfully because I was able to do all of that. So that was pretty funny. We had a big laugh about that.
That's so sad.
I went ahead and I called my sister, both of my sisters, because they were planning on coming to help. So 5 hours, so I could tell things were kind of like petering out. We decided to do the 3 Sisters of Balance that Spinning Babies recommends you do. So those are like stretches and positions that make it more mobile and easier for baby to make whatever rotations they need to make as they descend in the pelvis. So we did side lying release, we did some sifting with a rebozo, with me on all fours over like an exercise ball, and we would do forward leaning inversion off of the couch. And I do them with my patients pretty much on a daily basis. Even if it doesn't necessarily lead to any rapid change in progress, it helps people feel more comfortable. The rebozo sifting was really nice and really relaxing, and he would just gently sift, and it would kind of like rock and sway. It felt really good to have the weight of baby and belly and fluid, everything just kind of like taken off of your back. We called my sister to come up to help with childcare. We got ready for bed, and our whole like birthing space and room was like ready because we thought things were going to happen. So we knew that if things picked up in the night, that we were ready for everything. We had like plastic like shower curtain linings over some of the furniture that I expected I would want to use. So like the couch, I knew I would want to either labor on or rest on, like a plastic sheet and then a regular fitted sheet on top and some quilts and pillows. Like a stack of clean towels. We had a pillowcase full of like baby towels, baby blankets, baby hats. Then we put like a heating pad inside with the pillowcase and had that plugged in. And so that way when baby's born, we would have like warm blankets to wrap her in. My daughter, so she was 22 months at the time, she knew a baby was coming. She knew where it was coming from because we talked about it all the time. The first couple hours after my water broke, nothing really was happening, and so I took her on a walk in the neighborhood. It had just rained, and so I just like vividly remember going on this walk and her splashing in puddles with her rain boots. I just remember watching her splash around and thinking like, this is the last time I'm gonna just walk with one baby, like, be able to give her all my attention. So it was like a little bit bittersweet, but just like a really fond memory I have. A couple hours after falling asleep, my sister arrived. She drove overnight. And I want to say we slept until 7 or 8, and then my daughter woke up, and we were still nursing at the time. So she climbed into bed with me and wanted to nurse. And we were all snuggled and cozy. Within 30 seconds of her latching on and nursing, I experienced a painful, true, full-on like labor contraction. I was like breathing through it. And then another one came on, and they were just like rapid fire. And so I had to like stop nursing her because I was like, this is too much nipple stimulation. But my husband took her and brought her over to her auntie, and they did breakfast. And that was what started my labor, was nursing my almost 2-year-old. And they weren't all as intense as those first few. For about like 10 minutes after I had some really intense contractions, I could feel like more amniotic fluid coming out, and I was wearing Depends like all night, and like they just kept getting like saturated. The first like 5 hours or so after the water broke, I was mentally not in a good place. I was just like really worried that things like weren't really happening, that water was broken, but I was gonna need some sort of medical intervention. With those really strong contractions, I remember just feeling really relieved it was happening on its own. It was like comforting because I was so used to seeing patients not be like forced into making decisions, but be like heavily influenced. So it was really nice to not experience that. But there was part of me, like the labor nurse, I was like, oh my gosh, like, is this risky? Is this the right thing to do? The midwife was just like very reassuring. She cited statistics and research. And she also told me I could always opt to go to a hospital or do something if I didn't feel comfortable. The ball was in my court. I was in charge of my labor and what was going to happen. Contractions were coming every 2 minutes again, but instead of just the tightening and like feeling a firm belly, like I was feeling like this pulling. It was almost like Charlie horse pulling from my spine down through my pelvic floor and up. It was intense, and then they were still happening pretty frequently. My husband was like, you need to tell the midwife. And when I told her how often they were coming, she was like, oh, like I'll be there. And the birth assistant arrived before the midwife. She started doing like the spinning baby stuff with me. She gave me like a back massage, and just kind of like pampered me a little bit, which was really, really nice. The midwife came, and the first thing she did was talk to me to see how things were going. She observed a lot. A lot of her assessment was just kind of like watching me. And then she had me lay down, took vital signs, blood pressure, temperature, and then she like put her hands on the belly and kind of like felt for position and listened to the heart rate with everything was good and fine. And she's like, okay, go back to what you were doing. And when the contractions happened, I would assume whatever position was most comfortable. I really enjoyed like forward leaning positions. So leaning over the bed, a counter. Contractions went back to just being the firm belly without as much pain. And so we did another round of like spinning babies stuff. I asked about a cervical exam. The midwife said there was no like indication for it because baby was fine by the Doppler. I was doing fine. She is a huge proponent of not performing cervical checks on people whose water is broken. She wants them to have as much time as possible for their bodies and the uterus to do the work to dilate the cervix before introducing any bacteria. There was somewhere in my brain that maybe thought we should be like listening more frequently, but also like even though the contractions weren't really intense, my brain was definitely going into like the spaced out labor land. I like stopped thinking like a nurse and I started to think like more intuitively. The birth assistant had like some essential oils and she did like a little bit of like massage. They told me to like cuddle and cozy up to my husband and get some oxytocin flowing. There were some implied winks. We had a little makeout sesh to help. And after some of the making out, the contractions started to get like really intense again. The midwife suggested that we do some abdominal lift and tuck. It's used to help get the baby engaged in the pelvis. And at that point, my older sister arrived. She's someone who I'm really, really close with. I was super, super relieved. She arrived and I just remember like sinking into like a hug and just like melting. I think I cried. I think she cried, you know, just emotions. At that point, I was having to like really kind of like moan and like verbalize. A little bit shaky, feeling like I needed to like sink down. I couldn't just stand on my own. I needed to be closer to the ground. I needed support. Yeah, they started to like really hurt. My sister was there and the midwife and my husband, they were all like offering me like drinks and like telling me to eat crackers. The midwife stayed like really hands off. My husband and my sister were like so in tune with what I needed and with like jumping in to be like hands-on support. She just kind of like watched from the corner. I could tell they didn't want to be in the way. They didn't want to add any like pressure to the situation. I like that she was a safety net, but I also there was that part of me that was like, oh, like labor isn't intense enough, like nothing's happening, and I should need her more, you know? So I guess I wasn't like totally out of my head yet. And I think at this point I started like shedding layers of clothes. Like I was down to like my bra and maybe a skirt. At that point, the midwife came in and she was like, maybe you should get in the pool now. Like maybe now's a good time. And I was like, no, I need to save that for when it's really bad, right before she comes. Nothing is happening. And she was like, no, I think you should try it. It'll help you feel better. I get into the tub. The warm water was just like so incredible. It felt so nice and it just instantly like relaxed my body. I just like melted into it. It really did help dull out a lot of the pain. I do remember needing air blowing on my face. Like I felt like really flushed. What helped me get through the pain and the contractions was thinking about it being like one step closer to meeting baby, like remembering like how temporary contractions are. A lot of like deep breathing. So I got in the water and everything felt so much better. And the contractions really spaced out at this point. Like they were like 5 or 6 minutes apart. And so we're approaching the 24-hour mark of my water being broken. From a labor nurse perspective, that just seems like a really long time. But my labor nurse brain was like, oh, like things definitely aren't happening. Maybe 4 centimeters max. Like that was what I was thinking. Kelly comes in with her cup of tea and she's like, how's it going? And I said, Kelly, we need to do something, like help contractions get started. And she's like, oh, I don't really think you need that. And I said, no, it's never gonna happen. So she was like, okay, I'll go out in my car and see what I have. She closes the door and the birth attendant was like, oh, like maybe we should try another spinning babies position. And that was just the worst thing that ever happened. That was so terrible. It was worse than the abdominal lift and tuck. And that's when I really transitioned and felt the urge to push. And I was like, holy crap. So then the midwife comes back in like not 2 minutes later and like I'm making like guttural like bearing down noises. And she was like, yep, what were you saying to Mary? Like she literally called me out on it. I was like, this feels very different. There's all this pressure. It was the constant pressure, the sensation of not being able to help pushing. I asked Kelly, like, did she want to check my cervix to see if I was fully dilated, to see if it was safe to push. And I was really surprised when she was like, nope, do what your body says to do. I didn't do like full on pushes. I just kind of like bared down a little bit. It really helped with the pain. I could feel her getting lower and that was so cool. Like being able to like tell that was happening because that did not happen with my first. But this time I like could tell what was happening and I felt like in control and that was super, super cool and empowering. Probably like 2 contractions. I like reached down and I could like feel like about this much of her head. She was like, oh, do you want to catch your own baby? And she said that a lot of her clients would actually like put a little bit of pressure on their baby's head as their baby crowns, to kind of like guide the head away from like their like pubic symphysis. So I did some of that. Feeling my baby's head as I was pushing like was so surreal. I was like, oh my gosh, like this is happening. Like I could feel her head coming out. It felt like the most massive shit I've ever taken. Well, there was like some burning ring of fire, and I tried to be mindful to be like really slow so as to like minimize tearing. But there's just like, once you reach a point, like the ear comes out and then it's just like, just all explodes out. And like her whole head's out. And so the labor nurse brain is like, head's out, because we always mark the time that the head comes out in case there's a shoulder dystocia so you can keep track of things. So I announced to everybody, but I'm just like, yep, head's out. I was like, okay, do I keep pushing? Because I had like my brain, like I couldn't remember what to do. And she was like, well, are you contracting? And I was like, no. She's like, okay, wait for the next contraction. I waited for the next contraction. It came like 30 seconds later. It was just like one more push and she just like flew out into the pool. And like the body coming out was just really easy. Just, it felt kind of like a fish, just like whoosh. The midwife assistant like reached down and like handed her to me, and I just like fell back onto like the side of the tub, and my husband was there, and I just held her little slimy body. I was just totally relieved and elated, and also just like, wow, I did that. Like, did that just happen? But mostly just like utter relief and joy. Hear the midwife just like also sounding really proud in the background saying, you did it. And like everyone's like cheering, and it was just so incredible.